Is snoring with enlarged tonsils more common in children or adults? Have you ever wondered why some people snore more than others? One factor that plays a significant role is the size of the tonsils. So, is snoring with enlarged tonsils more common in children or adults? Let's break it down. Snoring linked to enlarged tonsils is actually more common in children. In fact, enlarged tonsils and adenoids are the leading causes of airway blockage during sleep in kids. This often leads to snoring and can even cause obstructive sleep apnea, which is a serious condition. The tonsils and adenoids are located at the back of the throat and are part of the immune system. When they swell due to infections or are naturally large, they can obstruct airflow, resulting in noisy breathing during sleep. In children, this condition is the most frequent cause of sleep-disordered breathing. It can lead to symptoms like loud snoring, mouth breathing, restless sleep, and even behavioral issues or poor performance in school. Parents may notice their child is not getting enough restful sleep, which can affect their mood and focus during the day. On the other hand, adults can also snore due to enlarged tonsils, but it is less common for this to be the primary cause. In adults, enlarged tonsils may occur due to chronic infections or anatomical differences, but snoring and sleep apnea in adults often involve other factors. These can include obesity, changes in other tissues in the airway, or loss of muscle tone. When adults do experience tonsil-related snoring, they might have symptoms like a sore throat, difficulty swallowing, frequent snoring, and daytime fatigue. However, the effectiveness of tonsillectomy, which is the surgical removal of tonsils, for treating snoring or sleep apnea in adults is less predictable. This is because adult sleep apnea usually has multiple contributing factors beyond just the size of the tonsils. From a sleep apnea perspective, enlarged tonsils in children are a major risk factor for obstructive sleep apnea. Treating this condition, often through tonsillectomy and adenoidectomy, can significantly improve breathing during sleep and overall health. In contrast, managing snoring or sleep apnea in adults typically requires a more thorough evaluation and treatment plan that considers various anatomical and lifestyle factors. So, to answer the question, snoring with enlarged tonsils is indeed more common in children than in adults. For children, enlarged tonsils are often a primary cause of snoring and obstructive sleep apnea. In adults, while enlarged tonsils can contribute to snoring and sleep apnea, they are usually not the sole cause. Understanding these differences is important for proper diagnosis and treatment in sleep apnea management across different age groups.